Hi, I'm Allison Frazier, Director of Economic Policy Studies at the Heritage Foundation. One of the things I work on and am very concerned about is the long-term costs of the federal budget, especially when they pertain to health care. Now, Jared Bernstein of the White House says that we can't afford not to pass President Obama's health care reform plan.
We can't afford not to fix this problem. Whether we're talking about middle-class families trying to make their ends meet in a climate where healthcare premiums are rising 3 times faster than earnings, or where American businesses face a huge competitive disadvantage relative to overseas competitors, again, we simply can't afford not to reform healthcare in America.
That's right. I do believe we have a huge problem that we can't afford not to fix. I just think they're going about it in entirely the wrong way. Let's start for a minute and think about the huge problem that we already have. Social Security, Medicare, and Medicaid, programs that have been in existence for decades, are already wildly unaffordable. Over the long term, Social Security and Medicare alone have excess costs of $43 trillion. And when you add those in with the national debt, that comes out to be about $184,000 for every man, woman, and child in America. America's seniors are going to have to make some tough choices. I just think they ought to do it in order to pay for this existing problem we already have. Now, all of this focus on the deficit in order to pay for Obama's health care reform is certainly important, especially in that long-term context. But it's only a starting point. I think the missing element from this debate is really how big spending is. So when we look at the 2 bits of legislation, the House TRICARE bill would spend about $1.3 trillion over 10 years, while the newly released Senate bill proposed by Senator Baucus would spend almost $800 billion. That's way too big, whether it's fully paid for or not. So how would President Obama actually pay for his health reform? Well, squeezing Medicare doesn't sound so bad, does it? But what it would really mean is cutting reimbursement rates for doctors and other healthcare providers. What that means is putting the squeeze on your doctor. It would also mean cuts to the really popular Medicare Advantage program, and that would mean increasing out-of-pocket costs to seniors. It would also involve tax hikes, especially on America's small businesses, which means it would harm jobs. It would also harm America's competitive position abroad. So, is Obama's health reform plan really paid for? Under Senator Baucus's version, we start with a $43 trillion problem, cut Medicare for seniors, add a bunch of new benefits, and end up with a $43 trillion problem. Under the House legislation, we start with a $43 trillion problem and actually add to it. Spending skyrockets in the out years, so over the long term, we would be adding $9 trillion on top of the $43 trillion. Either way you slice it, we're not taking care of the problem that we need to. So if we really want to slow costs, let's start by fixing the problem we already have, the $43 trillion problem. That's the one that we can't afford not to fix. So if you want to see more videos like this one, please go to fixhealthcarepolicy.com.